afternoon, ladies and gentlemen. It's a great honor to be here. I'm not a wellness expert, but I think I can claim to be a healthcare expert. I'll show you my credentials in a moment. I was invited to speak here because of a speech I gave in Lake Nona in the United States earlier this year. And basically have written a book which has been sold in 109 countries. And that book's called In Search of the Perfect Health System. And in a moment, I'm going to, in 20 minutes, try to summarize the book so that you can see that no system has a perfect health system, no country, but we all have something to teach and something to learn. And I particularly want to focus today on prevention, of course, because that's, I think, a subject which is very close to the confluence and convergence between health and well-being. So this quote, of course, is pretty well known. And certainly over the last 10 years, I've had the opportunity to work in 77 countries. So I flew in last night from San Jose, and the week before that was Singapore. And I dedicate all my time to working with public and private health clients around the world. I'm also one of the 12 members of the World Economic Forum for Health. So I get to have a great overview of most of the tectonic developments in healthcare, including prevention as well. As you can see, I've still got, unfortunately, quite a bit of Africa to do. But I'm working in about 35 countries a year. And of course, a lot of our work is with governments, but also with health systems. And you'll be familiar with the health systems of your own countries as well. What I've been asked to do now is just talk briefly about, as I said, the book. And the book is written from three perspectives. Perhaps most importantly, 10 years ago, at the age of 42, I survived prostate cancer. So the book is written from my perspectives as being a patient as well as a healthcare professional. And of course, that's a very humbling and salutary experience. And we can talk a little bit about that if there's time. The book is also, of course, written from my experiences with clients, literally thousands of them. And also as a former Director General of the English National Health Service, the world's fifth largest organization on the planet after the Indian Railways and the Chinese Red Army and the US Defense Force. Oh, and Walmart as well, becoming at number 5, the NHS. Obviously, my experiences of running very large health systems. And just one word on that, of course, the NHS itself employs over 1.2 million people. Do you know we reduce turnover, staff turnover, through well-being in the NHS? Each, by just 1%, each hospital would save in excess of £1 million. And if you think about the number of organisations in the NHS and think about how well-being and wellness can improve productivity and reduce sickness absenteeism, I think there is an unexplored area for you to think about over the next period or so. My own organisation, KPMG, is 150 years old. We operate in 157 countries. We're now actively working with some of your organisations for well-being and wellness. So we've introduced mindfulness, spas, massage, meditation, yoga, and on-demand general practitioner services as well. And I think it's a very large industry, as you know. It's about $500 billion or so, but it's going to grow quite considerably. And the reason why it will grow is, and I'll come to this later on, is that by 2030, the world is forecast to be short of 18 million healthcare workers, representing about 21% of all capacity to care. Now, we'll talk in a moment about how prevention and well-being for the population and patients can reduce that number. But equally, of course, if you're looking at a 21% shortfall in your workforce, in your caring staff, then of course you have to start caring for their productivity and well-being a lot more. So I think in terms of looking through the delegates that are here, I think there's a great opportunity for some of you to think about how you start to approach health systems, not only to talk about well-being for populations, but perhaps more specifically, well-being for staff. Because put quite crudely, there is no healthcare without the workforce. And you have a great opportunity, I think, to start to convince people with your enormous body of evidence, some of it backed up by science, to actually start to think about the return on investment in the business case for keeping health workers healthy. And the reason why I say that is because of this slide. Now, I don't know how many of you are well versed in healthcare, but this slide for any developed or developing country is a very, very explosive slide. Essentially what it says is that for the last, actually since the Second World War, health expenditure has been on average 2 percentage points of GDP higher than national economic growth. And of course, if you extrapolate that, of course, then you run into a system where healthcare, if you project up to 2050, literally can bankrupt most countries. So trying to control this graph, trying to reduce, or as we say, bend the cost curve, is a very important thing for countries, for their global competitiveness, and also the way they treat their citizens as human beings and patients. And you can see here, I've mentioned the 18 million workers being short, but of course, many non-communicable diseases really are matters of lifestyle. And that's where I think the convergence and confluence between wellness and health is your business as well as my business. Now, healthcare is the second largest industry on the planet. I saw, I think it was yesterday, that you've updated these figures. I have to tell you, as I was flying across from San Jose yesterday, I was staggered at the size of the wellness industry. I've learned something, thank you very much indeed. And of course, I think yesterday you were told that the total spend now is over $4 trillion. The total spend in healthcare now is approaching $9 trillion, by the way, but we won't quibble. It's a lot of money being spent in healthcare. And clearly, if you think about prevention, as I'll go on to in a moment, many of the areas that you're focusing on, I think, speak to the healthcare workforce, but also to the population at large. So, in the remaining 17 minutes that I've got, the world does not have a perfect health system, but if it did, it might look a little bit like this. Now, if your country is not on this slide, please don't be offended. As I'd said before, we all have something to teach and all have something to learn. I can't go through all of the detail of this one slide, but let me just say a few words on some of the countries. So, for example, if you think about the health promotion of the Nordics, well, why did I choose the Nordics to be the best example of health promotion? I think you're from Sweden, is that right? That is correct. Yes, well, you look mighty healthy. Well done. Now, the reason why I chose the Nordics is for 3 reasons. First of all, the Helsinki Agreement of 1987 got all 5 Scandinavian countries together before any other country on the planet, and they said, we want to do something about health promotion. And for literally now, since 1987, there's been a 2% per annum reduction in smoking rates and also alcoholic consumption, with a few blips along the way. But that's now, what, 30 years ago. The Nordic countries got together and said, basically, we are going to start promoting our national policies of health promotion way before it was fashionable, way before other countries started to think about it. But then they did 2 other things which are really important. And one of these 2 things speaks directly to your industry. The second thing they did, by the way, before I come on to the cherry on the cake, is that they managed to coordinate national efforts with regional and local efforts. So they had wonderful alignment of effort and focus between their national governments and their local municipalities. But more than that, and here's the third reason, there are 2, I think, copies of my book outside, and I'm going to give one of them away if anyone can answer this question. Because what the Scandinavian countries did, perhaps counterintuitively, given their social welfare structure, they realized that basically, if you don't speak to the private sector as an employer, you miss most people in terms of thinking about health promotion. Of course, there's a big debate, and lots of investment should be going into children. That's where the investment should really be. But my question is, and you get a free book, and I can also devalue the price of the book by signing it as well at the end. But would anyone care to tell me what percentage of the developed world's workforce works for the private sector, and what percentage of the developed world's workforce works for the public sector? Would anyone care to guess? Now, I've been told you're all super intelligent, so I'm sure I can just pick on somebody and they will give me the answer. What about the lady from Sweden?
I was afraid you were going to pick me. I was looking down.
Just, no one's listening. No one's listening.
I would say private sector 30 and public 40.
Well, it has to add up to 100, but never mind. Okay, so she said private sector 30% and public sector 40%. Okay, don't worry, no one's listening. Don't worry. Okay, now the answer, thank you. Yeah, 40-60. The answer is 80% in the private sector and 20% in the public sector. Now, if you think about it, and of course I used to work in the public sector as a Director General of the National Health Service. I now work in the private sector. But if you think about it, most public health efforts are really a lot of public health people talking to each other. And actually what the Scandinavians realize, clever people that they are, apart from one or two, is, sorry, they realize that if you want wellness and well-being and health promotion to be taken seriously, you work with employers. Now, of course, those of you from the United States will be well aware, because employers do pay for their health care, that they have a direct pecuniary and financial incentive to keep their workers healthy. But the Nordics basically have spent the last 30 years trying to find ways in which the private sector employers make life better through promotion and prevention for their staff. The second area I want to think about, and of course there are very few people, I guess, from Africa here. I've seen a few spa retreats, but the point I'll make about Africa is really a more broad point as well. I don't know how many of you know that 25% of all the world's disease burden rests in Africa. Now, for the chance to win the second book signed, what percentage of the world's health workforce does Africa have? It has 25% of the world's disease burden, but it has what percentage of staff? Who said 5? Very good. The answer is 4%. So, if what we've found in Africa, working with actually non-governmental organizations, and it's simply a matter of life and death, is that they spend a lot of time training their patients and community elders to provide care to themselves. Now, no health system in the world will remain or become sustainable unless it activates patient power more. And of course, a lot of that in Africa is about HIV and TB. But if you think about the rise of non-communicable diseases, chronic diseases, basically I think you have some of the science, some of the armor, firepower, to help patients become more active partners in their care. And research that we've done, but also more importantly others, like the New England Journal of Medicine, shows there are 4 levels of patient activation. Level 1 is the lowest, the most slothful. You think your doctor is God. You are a passive recipient of healthcare. You are a grateful recipient of God's working on you. Level 4 is you take control of your health conditions and you actively manage them. Now, the difference, by the way, in cost between level 1 and level 4 is, guess how much? It's 21%. Think about that. There is a business case and a return of investment which is prima facie blindingly obvious. That the more patients do for themselves, the more they feel empowered, the less their consumption of care is. Because no one knows the patient as well as the patient. And a third country, just thinking about some of the things that you've been thinking or talking about over the last day or so, is if you think about mental health and well-being. Now, in many health systems, in many countries around the world, of course, mental health is a Cinderella service. It's poorly invested, but we know already that the costs of not treating mental health in the population are enormous, but at work, it's the single largest cost of absenteeism in work. It's higher than back pain. It's higher than lifting problems. It's all about mental resilience and well-being, which is why companies like mine, and we are not a charity, invest so heavily in mindfulness and well-being, because there is a clear return on investment. Now, I don't know where you're going next in terms of the new frontiers of your industry, but I think you should start to think about addressing your proposition, your value proposition, to workers and to employers, but especially to health system employers around the world. It's counterintuitive, I know, because you think they should be looking after themselves. You think the staff would know better, but they don't. And therefore, I think it's a massive opportunity for you, because we are going to be, in 12 years' time, let's call it 11, short of 18 million health workers. It's almost impossible now to close that gap. It takes, in most developed countries, 12 years to train a medical specialist. It's already too late. But you can be part of the solution. Isn't that cool? Isn't that wonderful? And they will all drink your coffee, sir. Now, I'm running out of time. I've only got 8 minutes left. But when I go to each country, my lovely global executive, Charlotte Refson, Dr. Charlotte Refson, who's a GP, she prepares briefings in 5 ways. Briefing about the country, its politics, briefing about the economy, briefing about the health policies of the country, briefing about the health systems and individuals that I'm going to be meeting. That's never written down, by the way, that last one. But when I go and meet government ministers or health systems, I play a game with myself now, because I'm visiting 35 countries a year. I have to keep myself awake and interested. So I play healthcare bingo. And when I read their documents and meet the health ministers and then meet the people who are running big health systems, I basically look for these. There's a mental algorithm in my creaking brain that basically runs through the words, the policy, and then when I meet the practitioners, I look at the practice. So this is my trade secret I'm letting you into. And these are the 10 things that I titrate any country's health system through. And let me tell you, in all of the countries I've worked in, the best score any country has ever had is 5.5. Now, you can play the game yourself later on if you want for your own country, and you can see how many of these policies and practices your country embraces and, of course, also implements. Now, let me tell you, the first one is your business. The first one is everybody's business. The best system I've seen in the world for segmenting patient needs, for population health management, for well-being and illness is Israel. Israel has a fantastic population health management system, which is driven by 4 HMOs. They're not-for-profit HMOs. The largest is an organization called Clalit. But they marry population health, so every night, 24 to 30 clinical sentinel indicators are sent into the cloud. It's then spun round in terms of the algorithms and artificial intelligence, and then alerts are sent to mobile phones for the community health teams to go and see the patients in their community before they get ill. The holy grail of healthcare is to be wise, not after the event, but before it. Now, you have a role to play in segmenting and stratifying populations. I think, honestly, your science base needs to improve before you're taken absolutely seriously at the top levels of health organizations. I was very pleased to see the World Health Organization were here yesterday. But your role, again, in thinking about how you help populations stratify and segment their illnesses between the diabetics, the hypertensives, the asthmatics, is to work, I think, once again, with employers. I think that's a great opportunity where if you got together and thought about your skill set and your global footprint, which is stunning, I have to say. What a wonderful job Susie's done and her team. But number one is the least well invested in healthcare, because it all goes into number 7. Hospitals consume 75% in most countries of all healthcare resources. But they're treatment factories. They're very important. When my prostate needed to be yanked out, I was pleased I was in a hospital, not in a Walmart. But the business case is all in number 1. People like us can help you. I'm not selling, by the way. I want to come back again. But you can build a business case. This is your business. You know more about this than I would say the health system does. I wanted to give you just a little glimpse, and I was so pleased that the previous speaker that's been honoured talked about climate change, as did the gentleman that talked about coffee. Just to give you a flavour on what's on my clients' minds, wherever I go, it's obviously in the book as well, these are the 7 things that most clients around the world, whether it's, last week I was in San Jose, the week before Singapore, the week before that Costa Rica. So whether it's developing or developed countries, these are the things that basically, by the way, Costa Rica's got a blue zone. I don't know if you knew that. Did you know that? I didn't know that until I went. It's really cool, isn't it? Full of Canadians. Anyway, we'll move on. So these are 7 things, with apologies to any Canadians in the audience. These 7 things are basically the hottest topics in healthcare. So number 1 is universal healthcare. Did you know the United Nations have agreed all 194 countries by 2030 to create universal healthcare across the world? Do you know what percentage of countries at the moment have universal healthcare? 40%. That's all. Imagine the war for talent in the next 12 years. If you're a doctor or a nurse or a clinical scientist in the audience, please let me know, because you're going to be very rich and very happy. Because there's going to be a massive war for talent. Think about what I said before. Do you know when Obama tried to get universal health care going in America, do you know how many people were employed in 4 years in America? 1.5 million extra health workers. That's more than the entire size of the NHS in England, itself the 5th largest organization on the planet. So the first thing is about universal healthcare. I can see one role for you in terms of thinking about promotion and prevention, but that's, I think, probably an arm's length relationship. Then the second one is about how you speed up innovation. I think you've got lots to teach many industries about how you speed up the pace of innovation, how you adapt and adopt at scale. Thirdly, a big issue about clinical quality, 40% variation in costs between different hospitals just because the doctors are not controlled, to modern improvements, Six Sigma and lean science. I've talked about the workforce. I've talked about patient power. Climate change, of course. I mean, we do a lot of work in the Caribbean, and just seeing those countries, those small islands destroyed, obviously from a moral and personal point of view, it's a tragedy. But the insurance premiums they're now paying are crippling their countries with debt. It's a very, very real problem. It's not just in Indonesia or in Japan, but these countries are being literally swamped through climate change. Now, we all have to think about our own role personally in our organizations in fighting that. And then finally, something you know a lot about is aging. Now, I haven't got time today to go into that talk, but 2 years ago, the Singaporean government, they're aging very quickly in Singapore, asked us to look around the world for the 25 best examples of how health services are responding to aging. And if you want, and this is the only plug of thought leadership that I will give you, if you go onto the KPMG website and look for an uncertain age, you will see 25 of the world's best examples of health systems sorting out aging from across the world. It's a good piece of work. We do some bad work, but that one's a good piece of work. So have a look at it, because I think it will also talk to you. You know more about aging from your industry's perspective than I do, that's for sure. And then just finally, as I come into the last 60 seconds or so, these are 5 things that are breaking in terms of reshaping healthcare: genomics, mobile health, the retail revolution, wearables, and dignity in death. I haven't got time to go into... I don't want to end on death, by the way, although I'm happy to do so if you want. But you know that most people would choose to die at home, but 75% of people die in hospitals, which are like literally about 150% more costly to die in a hospital than to die in home. I just wonder whether there's I don't know. I'll let you ponder on that one. And then finally, just one plug for my book. You can see here that my book was awarded Best Book in China last year. 4 million Chinese doctors voted for it. They were all instructed to vote the same way, by the way. I'm just joking. Just joking. But you can see, and also the year before for the British got the Best Book Award. It's been translated into Mandarin and Korean. And I'm going to Brazil, I think, in 2 weeks' time, and it's going to be released in Brazil in Portuguese. And my final, and forgive me for this, as I come down to my last 0 seconds, if you don't do anything else this Christmas for your loved ones, buy them this book. So this is my new book coming out early next year. And basically, I've decided to try and solve the global workforce crisis. And in it, you'll see 10 chapters on countries, how bad they are at planning for workforce and the healthcare, and 10 chapters helping to solve the problem. I hope for the second edition of this book, which is bound to be a bestseller, that I can write a chapter about the wellness industry. Thank you so much for inviting me, and God bless you all.